Hello, so now we'll talk about hyperthyroidism and hypothyroidism. So firstly we'll talk about hyperthyroidism. Hyper is more, thyroidism means more hormone of T3, T4. Okay, so first case which is very common in hyperthyroidism, that is the Graves' disease. Graves' disease. Okay, so this Graves' disease, it's an autoimmune disease. Autoimmune means what? Their auto antibodies are formed, that is TSI, the thyroid stimulating immunoglobulins. These are the auto antibodies which are produced against what? Against TSH receptors. TSH receptors are present where? TSH receptors are present in the follicles. Okay, you know na, the thyroid follicles has TSH receptors and TSH is produced by anterior pituitary. So there are this TSI are formed against the TSH receptors. But here is the twist. This TSH receptors are not blocked by TSI, but the TSI will behave like TSH. If the TSI will behave like TSH, it will activate this TSH receptors in the absence of actual TSH. Are you getting my point? TSH receptors are for whom? TSH receptors are for TSH. Okay, but in this autoimmune disease where TSH in the substitute of TSH, there is a autoimmune globulins, that is TSI. So now TSI will bind to the TSH receptors on the follicle. So now what will happen? Even in the absence of TSH, through TSH receptors, the follicle will produce T3 and T4. Okay, now TSI, what is this? The TSH action short life is 1 hour, half-life, and TSI's half-life is 12 hours. So you can see how potent TSI is. So it will lead to increase in T3, T4 production. Now even if the T3, T4 production is more, it will give negative feedback to anterior pituitary to produce, it gives negative feedback to anterior pituitary to produce less TSH, so that less TSH will bind to the less TSH receptors. Okay, it will give negative feedback to anterior pituitary. It will secrete less TSH. But what is the point? Here the T3, T4 concentration is increasing not because of TSH, it is because of the TSI. So this is an autoimmune disease in which TSI, which are the autoimmune globulins, they activate TSH receptors as they mimic TSH. Did you get? Now second cause of hyperthyroidism, which is less common, that is adenoma. What happens in adenoma? Adenoma is kind of tumor which is present in thyroid gland. Okay, if there is any tumor in thyroid gland, it will produce more T3 and T4. Okay, and if we compare these two, in the Graves' disease, in blood, in Graves' disease I'm talking, okay, in blood there will be more T3, T4. Okay, but there will be less TSH. Why? Due to negative feedback. Here, what will happen? Here, the T3, T4 concentration is more because of the adenoma. Suppose this is a thyroid gland, okay? So, this is an adenoma which is producing more T3 and T4. It will give negative feedback to the anterior pituitary to produce less TSH. The rest of the follicles, because of inhibited TSH, will produce very less T3, T4. But this follicle, which is adenomatous, will produce more T3, T4. This is the second, it's not very common cause of hyperthyroidism. Then there is hypothyroidism. Hypo means less, thyroid hormone. Now this, if we relate to the Graves' disease. In Graves' disease, there was autoimmune disease. In hypothyroidism, the autoimmune disease name is Hashimoto disease. In this disease, what happens? In here also autoimmune antibodies are formed, and these will also act on TSH receptors. But here what will happen? It will block them. Instead of stimulating as in Graves' disease, it will block them. Okay. So it destroys the gland rather than stimulating it. Then here what will happen? T3, T4 concentration will be less in the blood. Okay, so it will act on anterior pituitary and tell him to secrete more TSH. So TSH will be secreted more. When TSH will be secreted more, it will go to the thyroid gland. Okay, it will go to the thyroid gland to that this TSH through on TSH receptors and all. But T3, T4 will be less. Why? Because they are not capable of reacting with the TSH receptors because they are blocking it. Autoimmune diseases are competing with TSH, but they are blocking it. Okay, so what happens? TSH will keep on acting on it, and thyroid gland will be enlarged, and it will result into goiter. This is thyroid goiter. Like this, goiter is formed. If we have less T3, T4, it will go and stimulate anterior pituitary. It will stimulate anterior pituitary to secrete more TSH. Okay, if more TSH will be there, then this gland will be enlarged because T3, T4 still are not increasing. So it will cause goiter. Okay. Second cause is if iodine is deficient. If there is deficiency of iron, how T3 and T4 will be formed? Because it's triiodo, there's MIT units, DIT units which are formed, diiodotyrosin. So if iodine is not there, then how T3, T4 will be formed? Okay, then their concentration again will be less. This is present endemically, like if in some places there is an iodine deficiency in water, or nutrients are washed away in mountain, lake areas. Okay, there what happens? The iodine deficiency, so there will be T3, T4 deficiency. Now here also T3, T4 will be less, and similarly TSH will be more, and thyroid won't be able to produce T3, T4 more, but thyroid gland will be enlarged because of the more action of TSH. Here also there will be goiter, but there is endemic goiter. There is one more condition that is known as myxedema. This is a condition when there is total loss of T3 and T4 hormones. And last, there is a condition known as cretinism. Okay, cretinism is in fetal stage when there is less production of T3 and T4. They can be infancy, fetal, or childhood stage when there is hypothyroidism. That condition is known as cretinism. You can say infancy stage also. It can also happen due to endemic cretinism. Endemic means there is no iodine present. Okay, so the T3, T4 is not present. So it can be endemic, which is most of the cases. Or there is congenital lack of thyroid gland. If thyroid gland is congenitally absent, so these endemic or thyroid gland absence can cause the cretinism. Cretinism is only in the fetal or very childhood infancy stage. Okay, so this was the gist about the diseases of thyroid gland, hypo and hyper. Thank you.